r/AskReddit. Doctors of Reddit, what was a symptom a patient didn't mention that was really important? I had a guy come to the hospital who told me he had seizures every Tuesday like clockwork. This is highly unusual for somebody with a seizure disorder. It wasn't until I asked him about his social history that he told me he's a heavy drinker. I investigated further, and it turns out he binge drinks Thursday, Friday, Saturday every week, then stops cold turkey. He was having withdrawal seizures. Chest pain. Guy denied ever having chest pain, ever. Told us he was able to chop wood and work on his land without any issues. He didn't meet any criteria for additional workup prior to surgery. During his major surgery, he had a huge heart attack. A cardiac cath showed that he basically had one very narrow coronary artery that was the only thing getting blood to his heart. His daughters, who were nurses, all swore up and down that he was healthy as a horse and never complained of heart issues. Then his black sheep other daughter arrived and said he actually had told her that he terrible exertional chest pain every time he did anything, but that he didn't want his other daughters to know because they would worry. He died a few days later. If we had known all about his symptoms, he would have likely had his cardiac disease diagnosed and treated prior to surgery. Edited for typos, was on mobile during a break at work and didn't notice them until now. Edit 2. Since this post is getting a lot of attention, here is an informative article about chest pain from the Mayo Clinic. It's important to note that women and people with diabetes may not have the classic symptoms of cardiac chest pain. The American Heart Association summarizes some of these differences here. Edit 3. Thanks for the coins. And I'm sorry, but I can't give medical advice over the internet. If you are concerned about symptoms you or a loved one may be having, go to a doctor, please. This was my dad. Complained about chest pain to one of his friends one Tuesday but otherwise didn't tell anyone else or follow up on it. Dead Thursday. Oh, and it's apparently hereditary because I also had chest pains one day walking up steps, but based on my dad's bad example went straight to the doctor. Immediately after testing I was in surgery. Had a 90% blockage. My doctor used the word man killer. Do not ignore chest pain. Now the fun parts of the story. Outpatient heart surgery, medical technology is amazing. The only incision was a small cut in my femoral artery. Yes, folks, I'm living proof the way to a man's heart is through his crotch. Several years on after a major diet change, went from red meat 3 meals a day to 1-2 times or less a week, my cardiologist said I'm not only in better heart health than I was before but that I'm in better heart health than any patient he's ever seen. Medical intern here, had a woman come to ER complaining about stomach pain, took her full history, did the exam and vitals, she seemed fine, mild fever. Made a preliminary diagnosis of gastroenteritis and presented to my doctor. My doctor, who is female, goes to her and asks why she came to ER for something so mild. She says because she noticed blood in her stool. The doc comes out and asks me if I asked about her stool. I did. She said it was fine, and I asked specifically about blood. She goes back in and asks the patient why she didn't mention that to me. Her response didn't think it was appropriate to say it to a male intern. Turns out she had ulcerative colitis, needed a colonoscopy and long-term medical therapy and possibly surgery. I'm a student and on my family medicine rotation. I was sent to see this woman before the doctor and get a history and physical. She was saying she was having heartburn and just wanted us to give her something to throw up so she will feel better. I thought it was odd and so I went through some more review questions and she said her reflux pain was extending up to the left side of her neck and down her left arm. And that she had been sweating for hours. I cut off the interview short there and went to my teaching doctor to tell him everything and what I thought. Got an EKG. Yeah? She was having a heart attack, had to call an ambulance and get her to the ER. I'm a doctor. These stories are from a few years ago when I saw patients. I'm a medical intern, working the ed. Dude comes in with a heart attack. That part's clear as day. Gonna be medically managed, a procedure in the morning. I'm about to queue up some nitropast. It's a cream you put on skin that helps get blood flow to the heart, as my resident had seen him first and said it was okay. And I went through the contraindications as it was just habit at this point. One of them is recent Viagra use. The patient had said no to recent Viagra to my resident when his wife was there. He said yes to me when I asked when his wife wasn't. He wasn't using it with his wife. Nitropast was avoided. Blood pressure stayed okay. Coronary got stented in the morning, discharged the next day. Pro tip: while you toss the family out to do the rectal exam, ask all the questions they won't answer honestly. Okay, time for another one. Working the ed, lady comes in with a seizure, loss of consciousness. She's about 45. We're probably gonna watch her overnight. She's have been prescribed Tramadol before. I ask how much she takes. She's a nurse, she tells me what the prescription says. I do my usual, ever take double or half? What works for ya? As a means to get people to be honest. She's nervous. Well, these things can bother people with seizures, I say. She's more nervous. I then try them. Look, I don't give a shit, just lay it on me and we'll unpack it. She's taking 12 at a time, 4-6 times a day. She was about an hour late with the pills and seized. If I remember right, clearing 3 to 4 grams of Tramadol per day. People are getting high on 0.05 to 0.2 grams. She's doing a gram every few hours. Call the resident. Resident calls the pharmacy, I call poison control. We figure out dosing that would probably kill someone but is enough to cause her to not withdraw. She lived. I was pretty impressed that we titrated that down over the days she was in the hospital. Better do one more. This one isn't as serious, but it's a good story. Young woman, outpatient clinic. Has headaches, onset 4 weeks before. Okay. I go through the whole physical exam. A good history. Everything. Not really a migraine. But her head hurts every evening. Anything makes it better? No, just sleep. Sleeps enough, regular schedule, which is unheard of in folks with headaches. At some point, I just give up and ask what she does for fun. She plays this video game. Oh, that's cool, online and stuff. That's how I learned that she sat 14 inches from a computer screen 80 hours a week. She followed up a while out and said that she was still competitive in the game, was ranked quite high, playing 60 hours a week on summer break with taking breaks during the day. Admitted a baby my intern year that had transferred to our facility for persistent vomiting following surgery on a part of the intestinal tract. The transferring facility had wanted us to start the baby on a form of intravenous nutrition and offhandedly mentioned some low-grade laboratory abnormalities that they had attributed to the baby just having had surgery. I go into the room in the middle of the night, the first representative of our medical team to meet the family, and in the process of gathering the history, ask the family what color the baby's poop was. The family replied that it was white or gray and had been since birth and that they just thought that was how it should be. Record scratch. Big red flag. We ultimately diagnosed the baby with a rare genetic disorder that required an organ transplant. Edit. Thanks for the engaging discussion, everyone. To address some recurring themes, no. It was not biliary atresia, though that should be at the top of the list in anyone's mind when a baby has acolic stools, since the chances of success of the surgical correction of biliary atresia decrease the older a baby is. As for pediatric liver transplant, I am by no means an expert, but the donor pool is typically the same. They just harvest a smaller portion of the liver so that they aren't putting a huge organ into a tiny baby. And as for outcome, I've kept up with this family, if only peripherally, over the years, and the child is doing well. I'm reasonably well past my residency training, and this was early on in my first year of training. Saw a patient during follow-up for gynecological cancer. She said she felt great, the exam was normal. She was relieved, but she was so anxious it set off my medical spider sense, so to speak. I decided to push a bit further, which led to this conversation. Me, so you said you felt good? Absolutely nothing else bothering you? Her, oh, you know, some small things, nothing having anything to do with this. Me, well, why don't you tell me anyway? Her, well I kind of have this weird lump on my belly, a sweat gland or a greasy nodule or something. Doesn't really bother me, but I might get a dermatologist to have a look at it if it ever needs to be removed. Me, I see. Could you show it to me? She showed me, and I saw a skin metastasis, clear as day. Don't know how the story ended because I moved to different service immediately after, but if I had to guess, her life expectancy was probably measured in months.